صباح الخير على حضراتكم. بسم الله الرحمن الرحيم. أولا شكرا this very good opportunity for the second day. I'd like to check that everything is okay regarding audio. Is it okay? Is it okay?
Hello, doctor. Yes, it's okay.
Okay. Here today we'll go for an important topic after Dr. Maram, a very interesting session again about the patient education and patient engagement, bridging this gap between the education engaging patients. And I'll show some initiatives which I hope will be very useful and very inspiring for patient engagement. So next, please. Yeah, again, my resume. I'm honored to work for Novo Nordisk again for Novo Nordisk in the Gulf for about 12, 13 years, and I was happy that Novo is one of the sponsors today. Here, the patient engagement is briefly about improving the knowledge of the patient, empowering individuals to take control of their health. Normally, patient education, including storytelling, interactive visuals, personalized learning. A well-informed patient adheres to treatment plans, as we see. Next, please. However, always we are comparing between the education engagement. Does education secure engagement? What is engagement? Engagement of the patient includes the real participation of the patient in his healthcare or her healthcare journey, empowering him or her to make informed decisions, cooperate with the healthcare provider and take care of the wellness and increase. Sure, engaging a patient increases the loyalty to the pharmacy or to any healthcare provider. We are talking about a retail pharmacy or community pharmacy or any healthcare provider. So always we are searching and we are looking for engaging a patient, which is a new trend rather than just educating a patient. Let us briefly tell or summarize it as a comparison between one shot or one-way dialogue, which is the education, and engagement of the patient, which is a two-way dialogue. This is the other one, which is the patient engagement. Next, please. Next, please. Some features and some important aspects of patient engagement include communication with their conditions and the treatment options, using, of course, questioning, listening well, open-ended question, closed-end questions. Again, the aspects includes shared decision-making in the treatment, depending on his or her preferences and values. Self-management. We support the patient in managing the chronic conditions. Experience improvement, gathering the patient's improvement, gathering the patient insights to improve his healthcare aspects. So these are some of the aspects regarding patient engagement. Next, please. I know in some of the community pharmacies in Saudi, also in some governmental and military hospitals, I found some very good techniques in the specific strategies and techniques to increase this patient engagement. Some of these techniques are also held here in Egypt, in Alexandria, in Cairo, in any place, and well known, like healthy days. You establish some healthy days, you set healthy days for a patient, giving him some awareness, giving a two-way discussion about his case and his healthcare status, his treatment options and so on, making some assessments and making some tests like sometimes like for the in-body, for the body mass, testing the body mass index, measuring his blood pressure, measuring his blood sugar, and so on. So these are some techniques which are used in patient engagement. In addition to assessment, we set interactive sessions discussing together each, sometimes one-to-one or sometimes collectively with the patient, their status and how what they are suffering from the medication, what they are facing from the drug sometimes drug interaction. Diabetic patients during Ramadan, before Hajj, diabetic patient for the parents, diabetic pregnant, and so on. Diabetic foot. Not only diabetics, also this goes for hypertensive patients, go to hyperlipidemic patients, and so on. Data recording is very important. Patient data recording is a very important technique that sometimes you establish this or you set this through recording, even in a paper or in an Excel sheet, recording the patients, or in a specific software, recording the data of the patient. These data normally includes the name, gender, age, of course, his disease or his diagnosis, the medication history, and the frequency of your follow-up. You follow up with him every week, every month, every 3 months to check for this, and what's going with the patient. We have a very good experience specifically in the Arab region and here in Egypt from COVID patients. There were the COVID patient, the home isolation, العزل المنزلي لمرضى الكوفيد, were very, very crucial. It was very crucial for the COVID patients while he or she were in home, was seeking follow-up from the pharmacist, and this was very, very were very successfully implemented here. That community pharmacies here in Egypt might receive or might meet daily more than 200 COVID patients, 200 patients per day. Huge number where hospitals, even governmental hospitals and private hospitals, were not able to cover these patients. And the engagement and the whole follow-up of the COVID patients, specifically, for the mild COVID patients, they were, followed by the pharmacist, the community pharmacist. So it was very important. By the same way, as I mentioned, by following up over the phone, face-to-face meeting. However, there were some isolation, as we know, for the COVID. This is an important one. Next, please. Next, please. Yeah, some experiences performed by the pharmacist for patient engagement, and I think you will be happy with this. I'm going through 3 or 4 initiatives. One of them, it's an initiative. It's a British initiative, and were implemented here in the pharmacies, in government, and then in the community pharmacies, which is 1,000 golden days. ال1000 يوم الذهبية. The 1,000 golden days. It was an initiative which is concerned with the first 1,000 1,000 days of the baby. This actually dealt with it was a health campaign here in Egypt and focused on the first 1,000 days of life, from pregnancy ومن وقت الولادة 9 شهور 9 months of pregnancy which has 270 days in addition to 2 years after the child's birthday. So it's 1,000 from pregnancy to a child's second birthday. This period scientifically was found is to be very crucial and consists of 80%, 85% of the physical, mental, and psychological development of the person. These first 1,000 days. This initiative is a presidential initiative, برنامج رئاسي, and was implemented in the governmental sector mainly through pharmacists, and then went to community to private hospitals, and then to community pharmacies. And we managed to do it in some of the pharmacies through communicating with patients, engaging patients, raising the awareness, providing counseling, improving the productive health to ensure the better outcomes for the families. So this was very, very important initiative which is running now. And I remember that now about 2,500 pharmacists have been trained on this all over Egypt. One of its very good results and outcomes that the cesarean labor الولادة القيصرية have been deducted by about 20%. As you see some of the pictures here, photos of one of the team. Upside was a meeting. You will find the people from Azhar and the الكنيسة المصرية والأزهر, and it was a community initiative. هي طبعا كانت مبادرة مجتمعية نضمن فيها مدارس، ضمن المساجد، ضمن الكنائس، فكانت حاجة طبعا مفيدة وتحت رعاية نائبة وزير الصحة الأستاذة الدكتورة عبلة الألفي under her supervision. And this is one of the team together in the syndicate. This was a very, very, very good experience, and it is it's hotly running now. It's hotly running now. الألف يوم الدفعية. Next, please. If you can hear me, Nisha, next, please. Next, please. No, not the video, not the video. Not the video, not the video. No, not the video, please. Not the video, please. Not the video. A second one is one of the very good patient engagement experience. Here is the nutritional projects, which was done again, and this is a very important صيادلة التغذية again in the
Hello, doctor. Can you hear us? We lost the connection.